guys doing today?
Hi Susan, how are you?
Good, how are you?
Good, I love my job.
Awesome. Hey everybody.
Oh, hi Susan.
How are you feeling
I'm
today?
feeling better. I'm feeling better. I'm tired, but it's a good day.
That's good.
I always appreciate you coming in and taking the time, and you nurses are so great.
How's your care going, Shelby?
Good. She's doing well. Got good family support, so just doing our assessment here to start the day off.
Awesome. Well, I'll come check on you after our meeting.
Okay.
Okay?
Thank you.
You're welcome. So, what do you guys think this meeting's going to be about today?
I don't know. I'm a little nervous. They sounded kind of
Really serious? And
yeah. I think they're gonna make some changes.
Yeah. Hope they're good ones. Me too.
All right, everybody. Well, this meeting's going to be a short one, but we're running out of budget. We need to make some cuts, and we make them quickly somewhere. I was thinking of cutting out the oncology unit because they have a low census. We don't really make much money out of that department, but we're going to actually merge it with the med-surg. We do need to take care of oncology patients, but I don't think they deserve their own unit, so that's what we're going to do. Any questions, concerns?
Yeah. What will happen to the nurses on the oncology unit?
We're going to retrain them, hopefully, into med-surg nurses. Maybe, I don't know, we might just throw them out there and see how they do. We can't really afford to retrain them, but I guess maybe we'll just partner them with a med-surg nurse and see how they do. And
How's it safe for our patients?
well, safety is a focus, but you know, we can't function as a facility if we don't have money coming in. So we do need to make a profit, and having a bunch of empty beds on the oncology unit isn't really bringing in any money. So
Can you give me 2 weeks to come up with a plan to change these ideas?
I think I can, yeah.
Okay.
So Susan, thanks for coming in and meeting with us to go over your plan. So what are some ideas that you have?
Well, I've had 2 weeks to think about it, and these are the things that me and my nursing staff has come up with to save our unit. First, we have the emotional needs of the patients. They're a lot different on the oncology unit than med-surg units. They're more family-oriented and patient-oriented than more of their medical care.
Okay.
Hi, how are you today?
Hi.
My name's Sydney. I'm going to be your nurse.
Hi, I'm Shelby. I'm her sister.
Okay. Well, I'm going to be taking care of you today. Nurse gave me bedside report. She said you were like kind of sick.
Yeah, it's really rough. I'm really tired and I feel weak.
Yeah.
She's been getting weaker.
Yeah. Probably the flu, I'm assuming.
She does have cancer.
I'll be right there, Becky. Okay.
It's okay.
Becky. Becky.
Just trying to shut your eyes. Okay.
Where's my Jell-O?
I told you I would have it in just a second.
Well, my damn Jell-O now, lady. You're the worst nurse. I'm gonna keep hitting my call light till I get my Jell-O.
Oh, I hate my job. Okay, anyways, why are you wearing a mask?
They told me she's in, I think they call it neutropenic precautions.
Oh, well, I haven't heard that in a while, so just gonna, we're gonna go with it. You're gonna look at your meds, make sure everything's running okay. Wow. You got a lot going on here, sister.
Is there something wrong with it?
Oh, no. Wow, okay, hold on. Yeah. Look up your-
Where's my Jell-O?
I'll be there in a minute.
Is there any way that we can get a quieter room or shut the door or something?
Well, I mean, all the rooms are full, so it is what it is,
We'll just keep trying to get some rest, okay?
Okay. You look kind of pale though, so I'm thinking you probably have the flu.
I have the flu.
Probably.
She has cancer.
Yeah.
Terminal
Oh.
cancer. Yeah.
Oh,
They
that makes
said
sense.
that-
Yeah.
yeah.
Why is she on the oncology unit?
Well, they mentioned something about they were shutting it down,
Yeah.
so she
Well,
got moved out here.
That's
so.
gonna be a problem because I don't know what any of these meds are. Guess I'm gonna have to go ask. I'll be right back. Becky!
Hey, give me my Jello.
Becky?
Give me my Jello,
I told
lady.
you I'd be here in just a minute.
I want it right now. I don't care about those other patients.
She's sick. She's got the flu.
I don't care. I got the flu. Probably gave it to her. Give me my Jello.
3 more years till retirement. 3 more. 3 more.
I don't think we're gonna stay here.
I got you some flowers. Do you want some veggies? How about some, like, I don't know, broccoli?
I think they mentioned something about no fresh fruits or raw vegetables or
What?
flowers, so I'm not sure who brought the flowers in.
Vegetables are, like, good for you, right?
Yeah, it's just something about that precaution. I think they said it had to do with her white count being so low. So
Well.
could you take those out when you go?
I mean, they're pretty, though.
Yeah, I just want her to be as comfortable as she can.
All right. I'll bring them to Becky.
Thank you. Or you could just leave them at the nurse's station and I can get them when I leave.
Becky, I brought you some flowers.
I don't want that. I want
I'll
Jello.
get you some Jello. You need to calm down. Okay.
Okay, our next topic is medications. Each of our chemotherapy patients are usually on a long list of medications, and our nurses are specifically trained to know what each medication is and how to give it. And nurses on a med-surg unit probably don't know all the medications or how to give them and such. And then med-surg units also have a lot of patients, and each nurse has like 4 to 5 patients for a med-surg unit. And on our oncology unit, they usually have 1 to 2 patients, and it's more generalized and focused on each patient.
Yeah, that makes sense.
Yeah, for sure. Hey guys, how's it going?
Hey.
We doing good? Okay, whatever. All right, well, I'm gonna give some meds. How's that sound?
Oh.
Wow, we need to get some more of this.
Yeah, you do.
I mean, I washed my hands before I came in here. Sure did, yeah. So, I'm gonna give you like 4 different medications. First one's an A word. I'm gonna try really hard to pronounce this. It's Abraxane. Yeah, that one. I'm gonna give you Doxil. I'm assuming this has something to do with the flu, you know. I'm gonna give you morphine. Hold on, Becky. I'm pretty sure this is a pain med.
Dilaudid.
Almost positive. You can count on that one.
Are you sure you know what you're doing? I'm
Oh, yeah.
not trying to offend you.
No,
I just
no,
want
I
to make
passed
sure.
the boards.
I
It's
mean,
all good.
I'm really nervous for her safety.
I
at
passed
this
the
point.
boards in 225 questions. It is fine. Okay.
I don't really think that matters, but
Listen.
I'm just worried about her safety
What
at
are
this
you
point.
trying to say?
Can I get my Dilaudid?
I just
Hello?
should go.
Nurse?
I think that.
Dilaudid.
Can you talk to the
Becky.
manager, please? I'm concerned about her
Dilaudid.
safety. When
She's not
she's
even
done, you know,
She's what?
when she's done with her
Okay,
lunch.
yeah. You know, I don't really know when she gets back though, so it might be a while.
Well, we just would like to
maybe a
talk to
few
somebody.
hours. Okay.
Yeah, we're very
Anyways,
concerned.
you kind of interrupted me, so I'm gonna be giving her pain medication, and I'm also gonna give her famotidine. Said you've been having some like throat pain from like the flu, right?
She doesn't have.
Dilaudid, nurse.
All right, hold on. Excuse me.
Need my
I
drugs.
think this is
Becky,
What?
you are not
Where's
scheduled
my
for this
Dilaudid?
30 minutes.
Pain. Lady? Where's my Dilaudid?
You're gonna have to call security.
Where's my Dilaudid, lady?
You're not due for another 30 minutes.
Excuse me.
So, I'm gonna give you some medications. All right. Just gonna go ahead and set this up here. Yep, looks good. This isn't even connected to
What
you.
did I
It's really
say about my Dilaudid?
good. Becky, I'll be there in a minute.
I want my Dilaudid.
Ma'am.
Can't freaking pull this
It's
up,
okay.
guys.
She does this all the time. It's
Well,
fine. It's fine.
Hey!
No, it's fine.
She
Becky.
needs a mask on.
It's okay. No.
Yeah. This is my sister. Ma'am, can you?
Dilaudid, now!
She's got the flu too. You
Margaret,
guys
I'm
can be
gonna
buddies.
die
Yeah.
here. We have to go. Get my shoes. Get my shoes. We have to go.
No,
Hold on.
this
something about this. This is my sister, and no one seems to care of what I have to say or her needs as well.
I've been listening to you the whole time.
Please get her out of here.
Dilaudid, bleeding.
Come on, let's walk.
It's
Let's
okay.
walk and talk.
Just trying to relax. We're gonna figure this out, okay?
Hey,
You behave, okay?
Dilaudid's great.
All right. Well, apologize about that earlier. Becky's no longer going to be a problem. We got some things taken care of. So
Thank you for that.
you're welcome. So, how are you feeling?
I feel okay.
Feeling okay?
Just tired.
Your color's come back. I'm assuming is that, a brick thing, I'm assuming? Okay. Well, you go ahead and we'll listen to your chest, okay? Alright.
I don't think you have that on right.
I went to nursing school.
Her lungs aren't over on her
Oh,
arm.
yeah, I knew that. Oh, yeah.
Have you seen your manager yet?
No, I think she left for the day.
Do you have a number I can call or someone else that I can talk to?
Like a hotline?
No, someone in charge of the unit.
Yeah, sure. I'll
Something
get
needs to
right
be
on that.
changed.
Yeah, I'll get right on that. Sure. Okay, so your lungs are great. Heart sounds pretty good.
What do you mean by pretty good?
I mean, I don't hear anything weird, so I think that's a good sign. I'm gonna go check on Becky. She's actually pretty quiet over there. Hold on a second. Oh, she's still pretty good. Nurse. No. Stay. You gotta stay there. Oh, excuse you. Everything's great, yeah. Okay. So Becky's doing good.
Did you wash your hands this time?
Sure did. Definitely did. So anyways, tell me, what are your complaints right now?
Well, I'm just really worried about my care that I'm getting. This is not how they used to treat me.
Listen, I've been a nurse for 15 years. I know what I'm talking about.
Excuse me, I don't mean to be mean, but I don't appreciate the way that you're talking to my sister.
I'm just playing around.
Well, she's very sick, and I don't think that this is a joking matter.
Well, the flu is temporary, so
For the fourth time, she does not have the flu.
she doesn't really look like she has cancer either, though. So
Are you sure that I have the right meds?
yeah.
Can we get a nurse who knows what she's maybe if she's more experienced with these medications? Do they not have
Well, she's not really here.
any oncology nurses that are on the floor?
No, I'm your best bet.
Do you have your manager here, the oncology manager?
No,
Not
she's
yours.
gone. I told you she went to lunch.
That was your manager you were talking about.
Oh yeah. Well, I don't really know the oncology manager.
Well,
I
did
think
you
she's
find
like
out?
off.
I mean,
Maybe on.
her name is
I
Susan.
think she was going to Hawaii. Yeah, she's on vacation.
Maybe you could call Susan.
I'll try to get her number. We need to figure something out. Okay.
Well, very much enjoyed taking care of you. So I'll be back in a little bit to check on you. Okay. Okay. You're looking great. You're gonna be that flu. Gonna be gone no time.
What about the cancer?
You don't have cancer. I've been a nurse for
I don't
15
have
years. I
cancer,
know
she
this.
said.
All right.
I'm gonna get better.
I'll be back.
She's gonna.
The next point I have for you guys is retraining of all the nurses on both the med-surg and the oncology units. I feel as if it would cost a lot more money to retrain both sets of nurses because the med-surg nurses they have like a broad spectrum of what they know, and the oncology nurses have a pretty short list of things that they know how to do, and they're like experts in those situations. So I feel as if it would cost a lot more money to train both sets of nurses to broaden their learning and also to shorten it for the med-surg nurses.
Okay. Yep.
The next thing that we also I've been hearing complaints about is the patient satisfaction. On our unit, we strive for patient satisfaction, and that's one thing that we hold very high. And on the med-surg units, with having so many patients to take care of, our patients aren't feeling as taken care of and don't feel as if they're getting proper care and safe care, and that is really not done well with our patient satisfaction scores. And with patient satisfaction scores being low, we don't get as much money back for each patient that we care for.
Okay.
Well, Susan, I think you brought up some good points, so
Yeah, I do
we'll
too.
collaborate and then
Yeah.
we will get back with you. Thank you for your time.
Yeah.
Thank you.
Oh. Hey,
Hi.
how's it going?
It's good.
You feeling okay? All right, well, we're about to switch shifts, so just want to check on you, make sure you're doing okay.
Okay.
All right. Oh,
Hey,
hey.
how you doing, sis?
I'm okay.
Oh, I just wanted to let you know that I got a hold of Susan. She's not happy with the care that's been given,
What?
so she's on her way and she's gonna talk to you guys.
Okay. Okay.
How you been
Well,
doing?
I guess I'll just wait
Did you
for
get
her
any
here
rest
then.
on this con? Yeah. Okay. Good.
Yeah, that patient's quiet.
Good. I was hoping so.
When's she gonna be here?
She said she was on her way, so I don't know where she was coming from.
Okay. All right.
Hey guys.
Hey, what's up, Susan?
It's so good to see you.
Are you doing okay?
I am
Are you
Susan,
alright?
but
No,
it's just,
they've been-
I need some help.
It's
This
been
care
awful.
that you've been giving is unacceptable.
I've been given the best care that I possibly can.
This is why that we.
This is what I was that's what I'm trained for. You know, I've been given
It's not-
the care that I was trained for.
Well, this is why we don't need to merge our units together.
Yeah, no
Because
kidding. I mean, she's got
I mean,
the
I'm
flu.
I was
And
honestly
he's got
concerned. There
she's
was
got
a
the
patient
flu over
she
there.
was
They
in-
pass it to each other.
She's not been giving the time of day to listen
I
to
don't really think
her
she's got
complaints
cancer.
or mine.
Our very ill cancer patients need to be taken care of by oncology nurses, and med-surg patients need to be taken care of by med-surg trained nurses.
Well, then you need to tell my manager to give me a different assignment.
We can work on that.
Okay.
Thank you, Susan.
Yes.
Thank you for coming in.
Mhm.
We appreciate it.
Okay. Well, you're gonna get better soon. All right. This is not permanent. I mean, it's not.
She
So,
does.
anyways,
She
bye.
has terminal cancer.
See ya.
We're gonna figure this out.